Chronic sinus pain can be debilitating. Aching, pounding pressure, combined with congestion and discharge equals a lot of discomfort. Now, the balloon sinuplasty procedure can be performed right in the office. Dr. Zlab explains how the procedure works.
Sinusitis is the actual inflammation and/or infection of the sinus membranes that we have throughout the facial region, and it's really not an oftentimes correct diagnosis that people are diagnosing themselves with, and it just kind of ends up being a catch-all term, but it's actually the actual inflammation and infection, or inflammation and/or infection of the sinus membranes. If it's a true bacterial sinusitis, it's going to need antibiotics a lot of times, and the run-of-the-mill sinus infection could simply be treated with antibiotics. Sometimes we'll actually even use a little oral steroids or injectable steroids. Steroids diminish inflammation and swelling. If a sinus can't drain, there's the key word, if a sinus can't drain, it can't get well, no matter how many gallons of antibiotics you use. And so we need to facilitate drainage in some fashion. Decongestants such as Sudafed help. Moisturizing with saline sprays facilitates the sinuses to drain. So the key word is we must have the sinuses able to drain, or we're not going to make the infection better. The next level of treatment that's out there, if we're not having success with medical management, is either living with the symptoms and/or moving forward with some type of a drainage procedure, which means surgery. That has become rather revolutionized over the years. In the past, we used to be rather destructive in what we did up there. And what we've learned over the years is we need to minimize the destruction we do to that sinus outflow channel. Historically now, most of the sinus work is done through the inside of the nose with the use and aid of little telescopes, looking up into that outflow channel and seeing where the problem lies. All the sinuses, I tell people, are kind of like a little river system. There's several on each side, but they're all converging to drain into one common location, kind of like the mouth of the river. And if you can reestablish the flow out of that mouth of the river, then you get things flowing upstream. Balloon sinuplasty surgery is kind of the newest and most recent advances trying and attempting to minimize the destruction of the structures that are there, trying to reestablish the flow, but yet trying to minimize the destruction that's occurred. We went from a surgery where we used to strip out the entire membrane and make horrific incisions in people's faces, to using telescopes and certain little tiny instruments that would remove some of the tissue in that mouth of the river, to now where we just will, with the balloon sinuplasty, guide a wire up into the sinus, either with the aid of X-ray or with lighted instruments, and then slide a little balloon over that wire and blow it up, stretching out the mouth of the river, so to speak. Sinus openings are pretty tiny. For instance, the one in your cheek is only, in a normal healthy state, a couple millimeters in diameter, and so it doesn't take much membrane swelling to cause that to become obstruction. And so if we can slide that wire into that little opening and blow up the balloon and reestablish some openness to that sinus, now we've reestablished that flow without destroying any of the tissue, essentially. The recovery from balloon sinuplasty surgery is typically, since most of the time it is done under a general anesthetic, obviously it's going to be that day that they're down. Swelling and inflammation after any surgery is not at its worst until about 3 days into the recovery, and so those first 3 or 4 days, people will get pretty stuffy and pretty congested. I tell them it'll be like the worst cold they can probably imagine. Most people, 4, 5, 6 days just are doing phone works, computers, desk work, that kind of thing. They'll feel like they got a bad cold, but they'll be able to do a fairly normal routine. At 1 week, there'll be fairly normal routine with maybe some slight congestions.
For more information, contact the ENT department at 515-875-9450.